Welcome to Life by Design. I'm your host, Robyne, and I am thrilled to welcome you to this space for real conversations about how we live, how we show up day in and day out, because the quality of our life is shaped by our habits. What we do in ordinary time allows us to be extraordinary. We can unpack what it takes to truly live well and be well in real life. Welcome to Life by Design. And I'm just so excited that you're here. Welcome back to Life by Design. On today's episode, I had the opportunity to talk with Dr. Natasha Ramzan. Now, she is a clinical psychologist. She specializes in ADHD and in couples work. And I was so appreciative to be able to ask a clinical psychologist all the pieces around understanding ADHD, how it's diagnosed, and also the cultural component of how that impacts different people from different backgrounds, especially in our immigrant community who have this way of navigating this difference between living and surviving, which Dr. Natasha explained in such a beautiful way. I hope this episode is useful. And again, if you have questions, wonderments, curiosities about a topic, you want to learn more, you want me to interview somebody, bring somebody on the podcast because it's an area that you want to explore, please don't hesitate to reach out. We're here to be useful, and I hope this episode is one that you enjoy. So welcome to the podcast, Dr. Natasha. I'm looking forward to having you today.
Likewise, Dr. Robyne, thank you so much for this opportunity, and I'm looking forward to our conversation.
Wonderful. So one of the pieces I know about your work, Dr. Natasha, is that you approach things with what I think is such a refreshing lens of clarity, helping to make very complex areas really straightforward so that way we can really action and understand the impact. So
Mhm.
again, thank you for all the great work that you're doing in community and coast to coast and all the different places in which you support. And one of the key questions that I wanted to ask you to kick off this conversation is the idea around what ADHD right now is looking like in our communities, in our homes, in our organizations. And a question that I often get asked is, why does it seem like everyone now, or it feels like everyone now, is these late diagnosis of ADHD? And as a clinical psychologist, I thought you could help us shine some light on this.
Yes. First of all, thank you so much for having me again. And you
You're
can call me
welcome.
Natasha. Uh, I think in terms of ADHD, it's more kind of it's always been known like as kind of the male
Yeah.
diagnosis or boys at very young age when they're hyperactive, they get diagnosed. But women, unfortunately, sometimes they have so many masking behaviors where they have to be that good girl and kind of
Yeah.
behave. And that's why they get diagnosed really late. And I think that now we have a lot more awareness as well in terms of social media, just a lot of people who are coming forth without any kind of stigma. And there's a lot more dialogue and space to have
Mhm.
these conversations as well. I am personally diagnosed with ADHD inattention type, and yes, the in terms of the time management and kind of doing everything all at once and procrastination, not being able to get things done. I think a lot of those things when they do come up and then you're like, okay, there's something there. Like, why am
Yeah.
I functioning this way? These are the patterns. And there are some strengths to it as well. When
Mhm.
ADHD, it helps us to be more productive
Mhm.
and be more, again, ambitious as well, high functioning. And then it can also lead to stress and burnout. So I think a lot more people are becoming more aware and getting more diagnosed, especially high functioning women.
Yeah, I really appreciate that insight. And again, as you said, that historical piece, that diagnosis was not really ever something that was applied to young girls and especially teenage girls. So right now there's a wee bit of a almost like a reckoning where we're getting back into an understanding of it and supporting them in a different way. And the piece too, just to that thread, as a clinical psychologist, what is the actual like formal process for someone to be diagnosed as a person with ADHD. And as myself, as someone who has been professionally diagnosed with ADHD, I understand the process, but I just thought it would be useful for the people who are listening, because I get a wee bit nervous when I think people are diagnosing off TikTok and there's actually a formal process. So could you shed some light on
Yes.
that for us?
Thank you for sharing. Yeah, I had a bit of a laugh with TikTok self-diagnosis because a lot of our clients, they come in and they're like, "Well, I think I have ADHD." I'm like,
Yeah.
"Where'd you get this information?" Doctor Google, Doctor
Yeah.
TikTok, Doctor Instagram. Um, uh, I will speak on behalf of like clinical psychologist
Yeah.
scope because psychiatrists they have their own way of
Mhm.
diagnosing ADHD. Nurse practitioners they have their own way, but in terms of like a thorough assessment, it can take up to 6 to 8 hours. I usually split my sessions in two,
Mhm.
so I might see clients for 2 to 3 hours on one day, and then 3 hours on another day because of the attention span, and making sure that I'm getting all the information in detail, but also accurate information as well. So usually you will have a self-report questionnaires as well, and then you will have a thorough psychological assessment, ruling out any other diagnosis that might have similar symptoms. So, for example, bipolar and ADHD have overlap symptoms, so we want to make sure that it's not bipolar, or it could be a comorbid diagnosis, but we want to rule out everything else before we diagnose ADHD. It's a very thorough assessment process. We get collateral information as well. So I mainly work with adults, I don't work with children. If it was for children, you'll get collateral information from
Mhm.
teachers, school, parents. With adults, it's a bit different. So you might get information from parents if they're present, or maybe their partner, or maybe their employer after getting consent, just to get a better understanding of in terms of how they're functioning into their day-to-day life and how it might be impacting their relationships or work performance. And once the assessment is completed, then we have a feedback session, which is usually 30 minutes just to provide and help them understand what the results are, just to kind of simplify it so they're able to
Yeah.
understand. So no clinical jargon.
Yeah.
And then if they want to take the medication route or therapy route or combined, then we just usually refer them to a psychiatrist to get a consultation regarding medication. And then we provide executive functioning sessions, which focuses on, again, time management, organization, planning, just to keep them kind of helping them with their day to day functioning.
Yeah, that's amazing. And thank you for showing just that depth and breadth of the idea that this is something that there's a lot of energy, resources, there's a lot of understanding of how we can diagnose this correctly and accurately. So
Yes.
I really appreciate you showing that because, as I said, I do get a wee bit nervous when people are, identifying as somebody with ADHD and it's from a 10-second quiz that they've taken or something like that, where again, there could be other factors at play, and being able to have that thoroughness of a proper diagnosis with a trained person like yourself, I think it makes a really big impact, especially when we talk about integration and treatment options, because there's
Yes.
a lot of generic information out there about treatment. But when you find out what works for you, I think
Mhm.
that it could be so significant in improving quality of life for people and their families.
Definitely. It gives them kind of a clear pathway, like you said, in terms of, okay, this is what I'm feeling now. Okay, it's a validating,
Mhm.
kind of helping them understand how they're functioning and why it's impacting their day to day life. And it just kind of helps them to figure out what will work for them. But having a clear roadmap, which we provide, and we
Mhm.
support them with that roadmap. So yeah, I think it's really, really important to get that professional help and have a thorough assessment rather than going online and doing a self-report questionnaire and then that's it. You self-diagnose
Yeah.
yourself with ADHD.
Yes, exactly. And, as somebody who did receive a later in life diagnosis, I know personally it helped then have a lens in which I could look back on my, decades of my life and understand and have context in a new way that really put a lot of things in perspective. That a lot of it, there were seasons, Dr. Natasha, where, I took it very much as a personal failure, as a character flaw, that I wasn't able to do certain things that my
Yes.
colleagues or my peers or other people were able to do. And once
Yes.
I put that lens and I could see my behavior and especially my emotional well-being, understanding the concepts and the components of ADHD, I
Yeah.
noticed that all of a sudden I had more compassion for
Yeah.
myself than I ever had before. And that compassion really
Yes.
allowed me to be open to finding
Yeah.
different strategies for me. And even I think, again, in my own experience, the emotional piece was so important and
Yeah.
understanding all of these, as you called them at the beginning, these masking behaviors that we take on, all in the
Yeah.
spirit of adapting, right? We're just trying to fit in. We're trying to make sense of a world that feels pretty mixed up at times. And that masking behavior obviously gets us in a wee bit of trouble. It gets us off track sometimes in terms of our own well-being. And again, understanding that this was all adaptive. Like a lot of the habits and the routines that we pick up as someone with undiagnosed ADHD,
Yes.
being able
Yeah.
to then look back and realize, wow, this was adaptive. I was doing the best I could, but now I know better in a different way and it can look
Yeah.
different.
Yes. I love the part that you said compassion,
Mhm.
and I just want to kind of like expand a bit more on that.
Please.
With ADHD, I think a lot of people, there's a lot of shame associated with ADHD as well, because people they see that, oh, you're always late or you're
Mhm.
procrastinating, and then there's just so much shame, and then like you said earlier, this kind of this association with being a failure or not
Yes.
getting things done, and then having this impact on your self esteem as well. From the cultural lens, looking at kind of lack of mental health awareness in some cultures and stigma associated with that as well. Some people don't kind of follow through with the consultation or getting
Yes.
assessment because of that stigma associated with mental health. And then this another layer of kind of shame associated with ADHD. So I think compassion is so important. Just kind of recognizing that, yes, it's a strength and vulnerability and
Yeah.
resilience as well, in a way,
Yeah.
where I'm
Yeah.
recognizing and I want to do something about it, which gives them hope to,
Yes.
again, follow through with their inner voice, having that clear
Mhm.
roadmap and getting that diagnosis and yeah,
Yeah. And
basically proving the quality of life.
absolutely, and a thread to pull on, and I really love how you position this in your work around that inner voice,
Yes.
because I believe it was Alex Partridge's work that came forward that suggested that a child with ADHD is likely to experience, they estimate, 20,000 more
Mhm.
pieces of criticism than
Mhm.
a typical developing child. So if we think about as we're forming our self, our sense of self and our identity, if you also happen to have 20,000 more critiques or criticism or negative pieces that have gone into you building your sense of self, it's no wonder that self-esteem and
Mhm.
that impaired self-esteem is so prevalent, especially when we never even acknowledged it in the first place. And
Yes.
just that
Yeah.
notion of, we know what it feels like to get one form of criticism, like one piece of bad feedback or one critique or piece of criticism. Like as a grown up, we know how terrible that feels in our body.
Yeah.
Imagine a child in these key developmental seasons being exposed to 20,000 more critiques than the average person. So again, that compassion piece, I think, is, as you said, is so significant because it's
Mhm.
hard to kind of almost like reconcile that.
Yeah.
Because again, we internalize so much of it, and that inner voice can be quite critical if we don't pay
Yeah.
attention to it and reshape it.
Yes, and it kind of reinforces this self-doubt then as well, right? Because if
Yes.
your inner voice is kind of this self-critical little monster that shows up again and again, and then these external factors such as your family or teachers that are not recognizing, maybe sometimes, some children, they fall through the cracks and system
Yeah.
will sometimes don't have enough resources to provide the diagnosis, and sometimes there's a long wait list as well.
Mhm.
So, yes, all of that can have a huge impact on trying to fit into your
Mhm.
peers and having that shaping your identity. And then when they're transitioning from school to college, university, that's where they struggle even more. And
Yeah.
or from university to workplace, that's
Yes.
again different challenges.
Yeah, absolutely. And the other piece that I also see when I'm supporting adults thinking about this is, certain things, for example, like, sensitivity to rejection. And
Yes.
so, again, difficulty with our peers and even our colleagues, because
Yeah.
it's one of those things where, like, rejection doesn't feel good for the average
Mhm.
person. rejection to a person who processes information differently with like ADHD, that is like it's visceral. Like it is literally in our bones, the fear of that feeling. And again, how we try to overcompensate to prevent us being rejected by our peers, rejected by our boss. And even in the professional context, if seeing a colleague receive a promotion, even though it wasn't a direct rejection, it's this internalizing that we do. And that internal dialogue can be very stormy if we
Mhm.
don't learn strategies to identify it, to be able to label it as it is. And I know, again, personally, one of the, I kind of joke about it, but it's very true for me is, I don't believe anything I think or feel after 8 p.m. Right. Like any kind of thought that pops up after 8 p.m., by that time I am under resourced, my meds have worn off, and
Yes.
I just give myself full permission that whatever thought pops in or feeling that starts to bubble
Yes.
up, I just say,
Yes.
we'll tend to you in the morning hours when I'm better resourced, because those dark hours can be a struggle for us.
Yes, definitely. I'm glad that you're able to turn off your mind by 8 PM. Mine, it goes up until 11, sometimes like, "Okay, I need to shut down and, like,
Yes.
let's go to sleep," but it's sometimes it can be so hard.
Yeah.
And there's question about medication too. Sometimes people are like, "Are they addictive?" I think those questions, it's really, really important to consult with a psychiatrist
Yes.
and to make sure sometimes people are using substances, alcohol
Mhm.
to kind of have those conversations with their medical doctor before starting medication.
Yeah, absolutely. An interesting component that you've introduced to the conversation is talking about, people from different backgrounds, different lived experience, different cultural beliefs. And I really want to hold space just to recognize that I think anytime when we are recognizing that there are cultural differences, especially with how we think about emotional health, how we think about mental health, how we even just think about, normal development, it's challenging to think about that extra layer when there is the cultural component with it. And I can
Yeah.
recall when I was teaching at the university and we would have international students or students,
Yeah.
domestic students, we would make the recommendation that you might want to connect with our student services because we, clearly see that this is somebody who could benefit from that support. And I would hear them say back to me, Natasha, like, I can't be diagnosed. Like, diagnosing isn't in my culture. I wouldn't be able to go home if I
Yes.
received a diagnosis. And I just, as again, asking you as a clinical psychologist, when we think about the cultural differences, how do we even navigate that?
Yeah, yeah. So just using that example, right, in terms of the shame that comes with the diagnosis or how they're going to be perceived. So a lot of times, even my mom, she still thinks I am doctor of crazy people.
Oh,
Like
God bless her.
I can't. So
I love
so
everything about
that's the idea of mental health within my culture that, okay, you must be crazy to go and, see a shrink.
yes,
And then, sometimes our clients, they can't have online sessions because
mhm,
they don't have privacy, and sometimes they have to lie to their families that they're in therapy. Sometimes
yes,
they'll be like, "Well, it's a meeting, it's a school-related project."
yes,
So we invite those clients to come to our in-person location just to make sure that they have privacy. So there's a
yeah,
lot of shame and stigma attached to it, and I think that it's really really important for any mental health clinician to ask those questions in
mhm,
terms of culture, in terms of diversity, in terms of microaggression, like what comes up and how does it impact their mental health, and
mhm,
how the culture can be integrated in treatment as well, because that's
yeah.
a huge aspect of their life, which has an impact on them. So yeah, I like how you said that, some people they're just so scared to even get the diagnosis.
Yes, absolutely. And again, not to make light of it by any means, but it reminds me there was a comedian and he's from a Cuban descent and he said in his stand-up bit, he made a comment that, he was going to elementary school and teachers who didn't even believe in ADHD, they met me and now they believe in ADHD. And he said then he went home and he told his mom, the school says I have ADHD and his mother said, "You don't." So he
Yeah.
said, "So I don't have ADHD because my mother says we don't
Yeah.
have that." Right? Like, it
Yeah.
just amazing, and again, that's obviously like a satirical way to look at it, but this idea that, like, no, no, like, you haven't, in this particular case, he goes on to say, like, "You haven't earned your depression," right? Like,
Yeah.
you don't get depression, like, we survived this as an immigrant family, like, we
Yeah.
if anyone's gonna be depressed, it's us, it's not the children living
Yeah.
in, the better life circumstance, which kind of also
Yes.
brings for the notion, and I know that is done in jest, but there's a kernel of truth in the sense that there are differing beliefs about, what is anxiety, what is depression, what is, again, hyperactivity, and even learning disabilities are not always necessarily welcomed in certain cultures.
Yes, definitely. Yes. I think there's a different layer for learning disability as well, right? I think those
Yeah,
in some cultures they're not even recognized as being human or individual,
yeah, yeah,
or maybe kind of recognized as a burden, unfortunately.
yeah,
So, in I'll speak on what happens in my culture, and that sometimes
yeah.
when I tell my mom, yeah, I have ADHD, and my mom was like, well, you don't have ADHD. That's just an excuse for you to not
Yes.
work on management. And I'm
Yeah,
like, "No, I do have ADHD." And sometimes they're like, "No, stop using labels and, like, focus on
yes.
your time management." I'm like, "But my brain doesn't work that way."
Mhm.
And it's I think immigrant parents, the way they live life, I think they confuse survival with living. And
Yes.
those are two different things. Survival is just kind of doing what needs to be done in order for us to survive every day, as long as there's roof over our heads and that there is
Mhm.
food on the table or paying rent, mortgage, that's survival. But that I can understand where they're coming from because that's what they did in order to start a new life in a new country.
Yes.
Whereas I think the second and third generation were realizing, okay, survival is not just hustling and like working long hours because we've seen our parents do that,
Yeah.
but living is actually, okay, can I listen to my inner voice? Maybe it's kind of a let's break these intergenerational patterns. Let's live
Mhm.
differently. And even with that, Robin, there's just so much shame and guilt when we
Of
try to
course.
do something different. We're like, oh my
Yeah.
God, are we abandoning our culture, the
Yeah.
way, our norms are? And it's such a difficult challenge for people to overcome that. But then again, in our work, we provide that hope. We give them
Mhm.
space to have that dialogue and to normalize it that it's okay to live rather than
Mhm.
just survive.
Yeah, that's just such an important distinction, and I'm so appreciative that you presence that
Mhm.
because, as we were chatting about just before we hit record, and in the work that I'm doing right now, the body of work around hope, that very
Yeah.
much is this
Yeah.
variable that we're seeing, where sometimes what gets in the way of us being able to live hope filled is some of those kind of stories we tell ourselves about what is it okay to get our hopes up, or should I want more or better or different? And sometimes when we think about what's possible, if there's any friction between what our family believes or what people think we ought to be doing or should be doing, it's really hard to get our hopes up, even though we know that living hope filled is so good for us physiologically, psychologically, and spiritually.
Yeah.
So I
Yes.
would love to hear your thoughts around that piece around immigrant families. And again, we don't want to overgeneralize, but again, I appreciate there's differences amongst groups. However, just
Yes.
that piece around where hope fits in that
Mhm.
conversation, because you just brought an amazing distinction
Mhm.
between that idea of living and surviving. And I think there's a hope thread in there as well.
Yeah, yeah. So what I'll give you my personal example. My parents came here when I was 10, and Robin, I did not speak English. English is my second
Wow.
language. So I had to learn and that was survival for me, like just
Yes.
adapting to the new culture, a new country, learning a new language. It was difficult compared to my siblings. And I saw my parents how hard they were working in order to survive.
Yes.
And then during my teenage years, I was like, okay, I came here based on the sacrifices of my parents. I need to work really hard. So
Yeah.
I was
Earn it.
hustling,
Yes. Yep.
I have to
Earn
earn
it.
that success.
Yeah.
Even the word success, the definition of success is different. For my parents, it was like you going to university, you getting your degree and having a really good job. Okay, that's success. And we have
Mhm.
done our job
Yes.
for all the compromises and sacrifices. But then I was like, "Okay, is that it?
Mhm.
Because I can't live like this where I'm
Mhm.
working so hard and I'm burning out, just constant stress." And I started listening to my inner voice by doing things differently.
Mhm.
And that was, of course, very different than what my parents are doing, which is, again, working constantly, making
Mhm.
sure that there's no rest because rest is guilt. So you feel
Yes.
really guilt for resting because you're then wasting time.
Mhm.
So I learned to, again, slow down, which is really hard with the person
Yes.
with ADHD. And
Absolutely.
yeah, self-care without guilt and shame, that it's
Mhm.
okay to take care of myself and I don't have to work as hard.
Mhm.
And things can happen with ease and comfort as well. Started setting boundaries, which is huge in the South Asian
Yeah.
culture.
Mhm.
And yeah, being labeled as selfish, not
Mhm.
respectful, all of those things. But it's listening to that inner voice and having hope that I can do that hard work to break
Yes.
intergenerational patterns, and sometimes it starts with that one person.
Mhm.
And yes, it comes with a lot of challenges, shame, and guilt. And there's hope to kind of continue
Yes.
doing that and believing in yourself that it's okay to
Mhm.
want something different for yourself and that you are deserving,
Mhm.
rather than feeling guilty that, oh, maybe, my parents didn't get all of this. Now I'm feeling guilty that maybe I don't deserve a lot more than what my parents had.
Yes, and you again, that you articulated that so beautifully, that there's all of these different narratives. There's all these different pressures, and again, setting boundaries, looking after ourselves, changing even the pace in which we
Mhm.
approach the work, or that notion of, being able to essentially take a day off, or just being able to get some time. And I've even had conversations with my own three teenagers that, when I was growing up, and if the sun was shining, you are not indoors. Like, if
Yeah.
the sun was shining, the only time I was able to like read and like watch TV was like on rainy days. So
Yeah.
when there's rainy days, I actually like, oh, it's like the one day that I feel like I have this like silent permission slip that I'm allowed to watch a TV show during the middle of the day. And
Yeah.
but again, or if you're sick, right? Like if you were sick, or if it was really bad inclement weather, then you were allowed
Yes.
to watch TV during the day. So this was just a norm, that felt like a rule that I grew up with. So as a grown up, I'm looking at my kids and I'll notice, for example, if they're watching a television program on a sunny day, I actually notice that impulse where I want to correct it. But
Yes.
breathing through that, just having that self-awareness to be like, "You know what? No, it's okay to actually," I just was thinking of our daughter. She was, studying for her exams, and she, like, took just an hour to have a
Yeah.
snack and watch the show, and I'm like, "She's doing it the right way for her." And this is actually, as somebody who as a behaviorist, I know she's making a really, really good choice, right? This is better for her in terms of
Yeah.
learning. But I notice those waves, like, that impulse comes up that, "No, you should be doing it this way." So even though we're trying to listen to our inner voice, take a different route, there's some old lessons that are still pretty entrenched for many of us.
Yeah, yeah, and I love how you were able to pause and you were able to kind of just slow it down in the moment and listen to where it was coming from, why is
Yeah,
there that urge, and how, if you do act on it, how that might have an impact on your daughter. Just
yeah,
having some little bit of that time to herself and have a break. But most people sometimes they are not able to recognize that it's happening, and that cultural conditioning is just so ingrained that it's they don't even know when it's happening in the background.
mhm,
So when I work with my clients, it's really important to just even have that awareness, which gives them
mhm,
hope that, okay, things can
yeah.
change.
Absolutely. And for me, it's actually slowing down. It's
Yeah.
slowing down enough to pay attention, because I think when we're on autopilot, some of our deep conditioning, or our like deep old lessons that we've been, exposed to in earlier years, if we're not paying attention, we regress back. We lean into those, because it's the deepest part of understanding how we show up in the world. So I very much, again, hold space that it's hard to slow down. And especially, again, as we chatted about people who experience ADHD, and there's a benefit to it in a pretty significant ways for
Yeah,
not sharing it with the next generation inadvertently.
definitely. Just because it's familiar doesn't mean that it's always healthy.
Yeah, exactly. Oh, I love that. And so for someone who says in any context, regardless of kind of their circumstances, that they feel that guilt or that shame around anything involving self-care. And I did have a little chuckle when I read that part of your self-care is travel. Like I love that you're just like travel is something that's good for your heart. I love that. When people say they feel guilty or they feel like shame or, they just really struggle to take care of themselves because of, all different reasons, what is your invitation or what is your suggestion for how people can recognize the importance of it? Because I think they know it's important, but
Yes.
executing or implementing is very difficult.
Yes. Yeah, intellectually, they know that it is
Yeah.
important. And I think there's a lot of self care conversations on social media as well. Um, and at the same time, I think emotionally, they still struggle with it because of that conditioning throughout their
Yes.
childhood. If they've seen their parents constantly working, not resting, um, even my mom, like, I'm like, the house is clean. Can you just leave the
Yeah.
damn mop alone?
Yeah.
Just leave it.
Yes.
And
Yeah.
then, it's the sitting and just having nothing to do. It's just so hard for some people to just stay still and just be in the present moment because they are just so used to go, go, go. I think
Yeah.
it's really important to maybe just become aware of the narratives we grew
Mhm.
up with around resting
Mhm.
and the emotions that are attached to those narratives as well. And then what we do when those narratives do come up. So when that voice is telling you, well, why are you wasting time? Like, stop
Mhm.
watching TV or do something more productive. Or by the end of the day, even though you have accomplished a lot, but you're like, oh, I haven't done anything. Like,
Mhm.
what a waste of day. That
Yes.
self criticism, that shaming yourself, it's not healthy. So just sometimes just being even mindful of these narratives and the
Mhm.
emotions that come up, just noticing what they're saying to you and where they
Mhm.
come from, and then making a choice how you want to do something differently.
Yeah, I appreciate that so much. And I know, again, in my own learning and with people that I support, I realized that this idea that rest I had associated with being unproductive, and
Yes.
unproductive I associated with being lazy, and
Mhm.
lazy I associated with being a bad person. Like
Yeah.
laziness is a bad person. So for me, there were four identities that were being activated. And once I realized that the fact that, first of all, somebody who is lazy isn't morally flawed. They are not a bad person simply because they are not, doing as much as they could be doing. What happened for me is when I started to realize that, man, I am pairing rest with unproductivity, and being unproductive is a moral flaw. I realized
Mm.
that's where the issue was, that I needed to loosen that grip. And I remember, I think it was Dr. Gabor's work where he gave a reference point where he said, when you look at a baby who obviously is not very productive, right? That
Yeah.
baby is not joining Zoom calls. It is not making a livelihood. Like it is literally just surviving and just growing. Yeah, when we look at that baby, we don't say like, "You're not enough because you're not productive, you're not producing." We can
Yeah.
love that baby and celebrate that baby for that, season in the life that the baby is, and we haven't yet paired productivity with love and worth. And so, again, just using that gentle reminder that pairing of productivity and worth for many people, that's something that in some cases in some families has really been reinforced, and it's okay to loosen that and going back with that compassion and that empathy for ourselves.
Yes. I love that example. A baby can be just baby.
Yeah,
Doesn't need to
baby
join.
can baby. Yeah.
And these kind of like narratives that we grow up with and the modeling that our parents do for us and the cultural expectations, societal expectations that kind of shape that identity that, okay, I need to do more. I need to be on this go, go, go autopilot. And I think, Robin, I'm not sure if I want to hear your perspective, but I think social media is also glamorizing this hustle culture a lot more.
Totally.
Yeah, and a lot of people are kind of feeling this pressure that, "Okay, I need to do more. I'm not doing enough."
Yeah. Oh, 100%. And I do get so much I do get a wee bit worried, especially around the doing more in the realm of self-care, because if we
Yes.
actually sat down and wrote a list of all of the things that these, sources are telling us, whether they be
Yeah.
influencers or, even sound reliable, valid voices in the space. If we made a list of all the things that we are supposed to be doing, it would be a full-time job. I'm supposed to wake up at the
Exactly.
same time every day. I'm supposed to like have my tribe. I'm supposed to journal. I'm supposed to water. I'm supposed to, I'm supposed to,
Yeah.
all of the things. And I'm supposed to do, cardiovascular work. I'm supposed to do weight work. I'm supposed to wear a weighted vest. And like, oh my goodness, like, no wonder people look at all of that and say, you know what, I'm just going to curl up with some delicious carbs and some Netflix because that actually is easy. Like that is what I can handle right now. And it's not
Yeah.
misbehavior, that's stress behavior. And what I encourage people to think about is having just a few key practices that become your non-negotiables that work for you, that can
Yes.
stand the test of you
Yeah.
being able to do it even on a bad day. Be
Exactly. Yes.
because a lot of these programs, it's just not realistic, and then people feel even more sense of failure or shame or, disappointment, and that I think really crushes their efforts, and so they do nothing.
Yeah, you nailed it. You nailed
Yeah,
it. Like, I think people are burning out by doing all this self-care every day,
yeah,
and consistency becomes really difficult. And then people there are shaming themselves like, okay, I can't even do this. I can't even go to the gym 5 times a week or 5
yeah,
a.m. in the morning. Sometimes it
yeah,
can be unrealistic for some
mhm,
people. And yeah, I think it's like you said, no, do what works for you with your schedule rather than making it so hard for your
yeah,
self-care routine.
yeah, because if it's another thing on your to-do list, it's not self-care,
Yeah,
right?
no, it's
And
not.
so yeah, and the invitation I share with the teams in my groups and even in my community that I work with is if we think about these habits and if we
Mhm.
think about the one habit that we can actually invite to be a ritual in the sense of adding the emotion behind it. So for me,
Mm,
my morning walk with my dogs when I am home, my morning walk when I'm on the road traveling, it's like a
yes.
ritual. I have
Mhm.
this deep connection with being able to do that movement practices in the morning. I know it's going to decrease all cause mortality by 60%. Like I know the numbers behind it, but what I really focus on the feeling of the ritual of, first thing in the morning, I wake up and I go outdoors and if I can or find that treadmill because sometimes that's what's available, but I just look forward to it because it's this emotional recharge for me. It's not just another task on a to-do list that I have to try and knock out before a certain time in the day.
Yeah, yeah. There's that emotional energy and
Yes.
vibration that it kind of you're embodying when you're going out for a walk and you're doing it more often because it just makes you feel so good about the task or goal or self-care routine that you're
Yes.
doing. But it becomes like, oh, a dread, like, oh, I have to do this. Then it becomes more kind of like, okay, I'm not going to do this anymore. And then you shame yourself and criticize yourself.
Absolutely, and we are so mean to ourselves. Like,
Oh, yeah.
oh my goodness. It like, if we actually, like, put our kinda inner dialogue or that inner critic on, like, Post-it notes around, people would be like, "You're in an abusive relationship." Like, and not to be extreme, but it's like you talk to yourself in a way that's so, so critical and mean, and
Yeah.
as someone who has spent a lot of energy thinking about that, it's like, wow, I really wanna make sure I'm talking to myself in a way that's going to be encouraging and again compassionate just keeps coming back. One thing I would love, and I'm mindful of your time, but one thing I just want to pull a thread of what you just said because I loved hearing it from you is that piece about the vibration of what it feels like to be doing that morning routine for me. I love that kind of idea about vibration because one of the pieces I hear a lot is people, when I reference anything about vibration and energy, people are like, oh, that's woo woo. It's like, no, no, it is literally science. Like, it is not woo woo, it is science. We're energetic beings. It's literally
Yeah.
quantum physics, it's complicated science. And I would just love just to hear just a wee bit about if somebody feels that they're at that kind of lower, heavier, denser vibration, where would you encourage them to find strategies or ways of just increasing that lighter vibration versus that heaviness that I think is pulling so many people down right now?
Yeah, I think a lot of people are like, "Well, it's all woo-woo stuff, like, we
Yeah.
don't wanna do this and we don't wanna talk about it." And it's more about, again, the idea of your future self. Who do you want to
Mhm,
be? And can you be that person now?
mhm,
And, what I've learned from this work is basically do the work and then your emotions will come after. So,
Yes.
for example, I just get up, even if I don't feel like going to the gym, I know that it's going to help me after. It's going to make me feel better. It's good for my health. So, my future self would be kind of like thanking me that, okay, I went to the gym and I kept up with it. The people that you hang out with, again, you increase your vibration by being around people who support you, who make you
Mhm.
laugh. And when you walk into the room, some people will bring you down and some people will kind of increase that energy. The tasks that you do or the work that you do that kind of gives you that vibration. Like, I love what I do. I love helping
Mhm.
couples. I love working with clients with ADHD. And it just kind of gives me this buzz. Like, I love
Yeah.
it and I want to do more of it. So I
Mhm.
think it's more about listening to your body and how your body is kind of just engaging with that task. And that's where you can increase your vibration.
I love that.
Moving your body and just kind of
Mhm.
visualization can be also really helpful.
Yeah, I absolutely love that. Well, Dr. Natasha, I could talk to you for days. I appreciate your insights. You're so knowledgeable. If people want to work with you, learn more about your work, where would you encourage them to learn more about what you get to do?
So I'm a licensed clinical psychologist in the UK and in Ontario, Canada. And due to my licensing, I cannot work outside of these kind of
Mhm.
regions. And you can find me at Dr. Natasha Ramzan um, on Instagram and then also our website, innervoicetherapy.ca. And thank you so much, Robin. This was so lovely. And thank you for giving me this space and to have conversations about culture, hope, just everything that we shared today. So thank you. And I honestly, kudos to you for the work that you're doing. Your TED Talks are just so helpful. So thank you so much.
Well, you are so welcome. And just for folks who will make sure to put that in the show notes so we can capture that. And if you are looking to find like really like good resources, good support in a research informed, a licensed way, like this is what Dr. Natasha does. So making sure that if these are areas, couple work, ADHD work that you're curious about, finding the source, this is someone that is there, a trusted person in our communities who can help us find our way. So again, Dr. Natasha, thank you for your time. We'll put all your info in the show notes, and I hope we can connect again very soon.
Thank you so much, Robin.
You're welcome. Thank you for spending time with me on this episode of Life by Design. I appreciate if you have a moment to pay this forward, share it with someone who you think might benefit from the ideas shared in this episode. If you're feeling so inspired, please also rate and review the podcast wherever you listen to your favorite podcasts. Again, thank you for listening. Thank you for your time. Take good care, and I'll see you next time.